Dear students, welcome back. In the previous session, we have discussed about the structure of extensor mechanism and its influence on MCP joint as well as interphalangeal joints. Now, in this session, we are going to discuss about how tension is created in the extensor digitorum tendon and as well as the coupled actions of the proximal and distal interphalangeal joints. Here again you can see the structure of this extensor mechanism. Here the extensor tendon and this one is the proximal phalanx. Above this tendon, above this joint, this tendon is going to flatten up, that is called dorsal aponeurosis, and then you can find the three slips here. One is the central tendon and the lateral bands, and then the lateral bands are going to inserted in the terminal tendon, and also the another structure which is present olarly, that is oblique retinacular ligaments, which are crossing from olar aspect to the dorsal aspect, and it is getting inserted in the terminal tendon. Okay, now tension must be present throughout the extensor mechanism for effective action. So normally the tension in the extensor tendon is maintained by two ways. Okay, one is the contraction of the extensor tendon during active metacarpophalangeal extension, that is MCP extension, that to active MCP extension whenever it occurs, which is done by the contraction of this extensor digitorum tendon. Okay, then the tension is created. So that tension we have discussed in the previous session. Okay, next another one is by the passive stretch that is imposed on the extensor tendon during active MCP flexion. Normally MCP flexion is brought about by the lumbricals, isn't it? So, and intraossea also, that one we can discuss the separately. So normally the passive stretch which is imposed on the extensor tendon during active MCP flexion. So these are the two conditions where the tension in the extensor tendon is maintained. Okay, so whether any of these two actions, that is active MCP extension which is caused by contraction of extensor digitorum, and passive stretch which is imposed on extensor tendon during active MCP flexion, either of these two actions. So what is happening to complete this tension means, along with these two types of situations or the factors which is creating tension in the ED tendon, also requires an active contraction of either an interosseous or lumbrical muscle on the tensed mechanism to produce complete interphalangeal extension. Okay, only the ED tendon tension is not sufficient to maintain the complete interphalangeal extension, and also only interosseous or lumbrical actions is not enough to produce the extension. Okay, so for example, when the intrinsic musculature is paralyzed, only to extend the interphalangeal joints is the extensor digitorum. If that action has to be done, we have to passively flex the MCP joint. Either it may be by external force. Okay, so then only it is having ability to use the extensor digitorum to extend the interphalangeals with passively maintained metacarpophalangeal flexion is known as Bunnell's sign. Okay, so here the tension normally maintained by two ways. One is the contraction of ED tendon during active MCP extension, as well as by the passive stretch that is imposed on the extensor tendon during active MCP flexion. So whatever may be the actions is done on the ED tendon, so it requires an active contraction of either an interosseous muscle or lumbrical muscle on the tensed mechanism to produce complete interphalangeal extension. Okay, so this is about the tension which is created on the ED tendon. Now we will see the coupled action of the proximal and the distal interphalangeal joints. So there are three types we can see in between this proximal and distal interphalangeal joints. One is the active extension of the proximal interphalangeal joint. So active extension of the proximal interphalangeal joint will normally accompanied by the extension of the distal interphalangeal joint. This is one coupled action. And second one is active or passive flexion. Active or passive flexion of the distal interphalangeal joint will normally initiate flexion at the proximal interphalangeal joint. This is the second one. And the next one is full flexion of the proximal interphalangeal joint. Full flexion of the proximal interphalangeal joint, whether it may be actively or passively, will prevent the distal interphalangeal joint from being actively extended. So these are the three coupled actions which are taking place at the distal interphalangeal joints and the proximal interphalangeal joints. Now we will see one by one. The first one is the active extension of the proximal interphalangeal joint will normally accompanied by the extension of the distal interphalangeal joint. It is mainly occurred due to this structure, that is oblique retinacular ligaments. Okay, these oblique retinacular ligaments pass just olarly to the proximal interphalangeal joints and attach distally to the lateral bands. So the tension will increase in the oblique retinacular ligaments as the proximal interphalangeal joint is extended. So the tension is increased when the proximal interphalangeal joint is extended. Okay, if the lateral bands and the terminal tendon are already tensed by distal interphalangeal flexion. So during distal interphalangeal flexion, what happens? The structures which are attached here are going to be tensed. Okay, so if you actively or passively extend the proximal interphalangeal joint, which causes extension at the distal interphalangeal joints, which is already in tension. The structures which are attached on the distal interphalangeal joints are already in tension. Okay, so this is happening here, and normally the length of the oblique retinacular ligaments, normally it is having some change, or it is having different levels of contribution at the proximal interphalangeal extension to distal interphalangeal extension, which is done through the oblique retinacular ligaments, which is seen significantly only during the first half of the distal interphalangeal joints return from flexion. That is 90 degrees to 45 degrees of flexion. At that time the oblique retinacular ligaments are more stretched. Okay, next, this is about the first coupled action. Next we will see the second one, that is active or passive flexion of the distal interphalangeal joint will normally initiate flexion of the proximal interphalangeal joint. Now we will see how it takes place. Flexion of the distal interphalangeal joints produces flexion of the proximal interphalangeal joints by a similar complex combination of active and passive forces which links the proximal interphalangeal and distal interphalangeal joints. Okay. So when the distal interphalangeal joint is flexed, so how it takes place? By the contraction of flexor digitorum profundus muscle. So here, because of flexor digitorum profundus muscle, the DIP is going to flexion. Okay, and also a simultaneous flexor force is also applied over both the joints which is crossed by flexor digitorum profundus muscle. But here what happens? Normally this tendon is passing these two joints. Both will cause flexion at these two joints. But the effective flexion we can see only at the DIP but not in PIP. Why? Because at this PIP it is having some structures, that is extensor mechanism structures, are crossing over here. When these forces relaxed, then only you will get both the DIP and PIP flexion. Okay, so now we will see when distal interphalangeal flexion is initiated by flexor digitorum profundus muscle, the terminal tendon and its lateral bands which is attached are going to be stretched on the dorsal aspect. So here what are the things present? The terminal tendon and the lateral bands. So once this is going to flex like this, the structures here are going to be stretched. So once if it is stretched, what happens? The stretch on the lateral bands. So the stretch on the lateral bands pulls the extensor hood distally. So it pulls the extensor hood distally. Then what happens? At the proximal interphalangeal joints, the central tendon is going to relax. Once it is pulled distally, the structures are going to be relaxed. Once it is relaxed, then the extensor influence at the PIP joints are reduced and simultaneously causes flexion at the PIP. Okay, so that is the thing happening. How it is happening means. Okay, and the another structures. So here the lateral bands which are remaining taut during this action. So that has to be relaxed. So normally we'll have a triangular ligament in between these two lateral bands. So this triangular ligament is going to stretch here because it is having some elastic property. So it is going to stretch and helps in flexion of DIP as well as the PIP. So this is the second thing happened, that this is the coupled motion which is happening here. And the third one, the third coupled motion we can see here. So this is the thing happening in the third one. When the proximal interphalangeal joint is fully flexed. So here you can see when the proximal interphalangeal joint is fully flexed actively or passively, the distal interphalangeal joint is also so this is the proximal interphalangeal joints, this is MCP, sorry. So when it is flexed, so and also this distal interphalangeal joint is also flexed here. So if it is fully flexed, it is not permitting the distal interphalangeal joint to be actively extended. So now we will see how it is going to happen here. Yes. When proximal interphalangeal joint is flexing here, the dorsally located central tendon is being stretched. Once this is stretched, the increasing tension in the central tendon pulls the extensor hood again distally here. The distal migration of the hood releases some of the tension on the lateral bands. The tension in the lateral bands further released as the lateral bands separate slightly at the flexing proximal interphalangeal joints. So the releasing tension in the lateral band releases tension in the terminal tendon on the distal phalanx. As 90 degrees of proximal interphalangeal flexion is reached, loss of tension in the terminal tendon completely eliminates any extensor force at the distal interphalangeal joints, including any potential contribution from the oblique retinacular ligaments. You can see once all these tendons, lateral bands are getting relaxed, so the oblique retinacular ligament, which is attached dorsally over this lateral bands, which is also going to be relaxed. So once it is relaxed, so this one is also contributing extension at the interphalangeal joints. So now this is also not helping to extend the distal interphalangeal joints. So complete flexion at the proximal interphalangeal joint will not allow this distal interphalangeal joint to extend actively. So these are all the coupled actions which are seen in the extensor mechanism over the proximal interphalangeal joints and the distal interphalangeal joints. Thank you.